So they say in journalism, never bury the lead. So we wanted to be right out there and just point to the fact that there's no question, and we're going to hear and have heard already today and tomorrow, about business opportunities in new markets in digital health, in this case in caregiving, where digital health will play a role. And all of these are emerging markets with new players, some old players, but there is an incredible amount of activity that is going on right now. In fact, in the last 8 months, 3 startups have raised over $80 million from venture capital, with venture capital, have raised over $80 million, just 3 companies, right? Honor raised $20 million. Home Hero raised about 22 or 23, and Home Team just announced a B round raise of about 27 and change, and that was after just last June they raised 11. So $80 million, and why is that? It's because everybody is looking for where the next growth opportunity is. Where's the next growth market? And for AARP, we've been trying to put a lens on where that opportunity is that is driven by unmet needs, by patients, by caregivers, by older folks, by the families that support them, and to see where those unmet needs turn into market opportunities, where they turn into investment opportunities. And today, we're announcing the results of a new study, and it's called Caregiving Innovation Frontiers, and you'll be able to download it. Its predecessor is a study that we're actually updating for the 3rd time called Health Innovation Frontiers, which is more broadly on digital health. But again, what is it that is driving this? Well, what's really driving it is 2 things. One is that most people, north of 90%, want to remain in their homes. In addition to that, you have this total mismatch between the number of people who will be in need of care, and our forecast is that by 2020 it'll be just south of 120 million people, and the available caregivers that are there. You see the same dynamic even for those who won't remain in their homes, and that is a total disconnect between the number of people requiring care and the assisted living and CCRs and the nursing homes, et cetera. So you have this disconnect, and technology and services wrapping around it have to play a role. And in doing so, really do create huge market and business opportunity. So how much are we talking about? Well, that didn't come out right. So the total from this year through 2020 is $279 billion. And that's the aggregate of each year over the 5 years across 6 different categories of caregiving, which I'll get to in a second. But what you see in this chart is the fact that the 2 smaller bars, that is all out-of-pocket spend. That is unreimbursed out-of-pocket. So the issue of figuring out, in this market, we used to hear it was really code, right? Wherever you're at a digital health thing, the first question people say is, well, who's going to pay for that? And all that meant was, when is Medicare going to reimburse? When are the payers going to reimburse? And basically, it was a cop-out for not doing something, is how we viewed it. And so we said, well, look, nobody reimburses for vitamins, right? If there's a value proposition, people will spend money out of pocket. And that is very much the case in the caregiving space, where billions and billions of dollars is spent out of pocket, both by the caregiver as well as the care recipient. So there's roughly about 40 million unpaid caregivers in the United States today. And the economic benefit that they deliver to the larger economy is to the tune of $450 billion. That's an economic jolt that these caregivers provide. They get very little recognition and are under incredible stress. Some of the things we heard earlier in the immediate preceding panel. So let's go, there we go. So what are these different categories that this big $280 billion opportunity breaks down into? One is daily essential activities, we'll get into that. Health and safety awareness, care coordination, caregiver quality of life, social well-being, and transition support. One of the things that we saw early on in looking at digital health was that point solutions were being developed for people who did not make decisions and did not do things solely on their own. And almost everywhere, the caregiver, whether paid or unpaid, was typically left out of the equation. And now we're starting to see that there's a recognition of not just the need to bring in the caregiver, because frankly, the health outcomes are better, as well as assorted other benefits. But that's also where it's also a key to the market opportunity. So here you can see just some of the growth that we're talking about. And clearly the largest opportunity is daily essential, activities. And, this is where everybody's, spending, comes down to, meals and taking care of your home. And we've taken a very holistic view of this, right? And the reason is that it's really about living. It's about living independently. So we include something like home repair within this daily essential activities, because when people come back to the home has to change, right? When my father gets, kicked out of, Mount Sinai after having Rocky Mountain spotted fever, he can't just go back to the same house. He needs, supports. He needs other things that are going to make it easier for him to get around in a weakened state that he is not used to, nor my mother, who, and they both live independently, 88 and 86 years old. Go figure. I'm looking forward to those genes. And so, the growth here is about 13% a CAGR across the 5 years, but you can see where there are big jumps. And all of those numbers on the right, they end with a B, as in billions. And I always believe that numbers that end with B or T are the ones you should really focus on as to where the opportunity is. And in this case, we were very surprised at what this would look like. So just to tie it all together, over the 5 years, daily essential activities, $207 billion. That's the revenue opportunity there. Health and safety awareness, $20 billion. Care coordination, $8.4 billion. $21 billion for transition support, which is a major challenge for families who are dealing with the transitions that their loved ones are going through, whether it's out of a hospital or back from physical therapy or whatever it is. Social well-being and social engagement. And then there's caregiver quality of life. And this is one of the things, and my colleague and boss, Terry Bradwell, spoke about this earlier. It's like the care recipient is only helped if the caregiver is also helped. If the stress, the financial burden, all of those kinds of things are lifted from the shoulders of the caregiver, the quality of the care is going to be better. There's a startup in Massachusetts called SeniorLink, and they focus on duals, older people who are dually eligible for both Medicaid and Medicare. And what they do is they actually pay previously unpaid caregivers of Medicaid recipients, older Medicaid recipients. And the result has been that the Medicaid system in Massachusetts has saved several millions of dollars. Why? Because people who were previously unpaid are now being recognized, which emotionally is important, and they're also now not so much out of pocket. They don't resent the person they're caring for as much, and the health outcomes as a result are better, and therefore people stay out of emergency rooms and out of hospitals, and the total system saves money. So it's a virtuous cycle, and I love these counterintuitive models where you spend money and the system saves money. So lots of money to be made here.